controversy surrounding a proposed plan to crack down on the abuse of prescription painkillers. And it's certainly a growing problem in this country when we're talking about overdosing with painkillers. In fact, government statistics show that fatal overdoses involving painkillers now take more lives than heroin and cocaine combined. Well, now the FDA is considering a plan to limit daily doses of painkillers like Vicodin and Oxycontin and restrict their use to just 90 days for non-cancer patients. Critics say, though, that this plan could hurt people who suffer from serious chronic pain and actually not solve the problem at hand. Joe Schrenk is with us, an addiction expert who runs a recovery program called Rebound Brooklyn, and Dr. Philippa Cheatham is an attending physician at Winthrop University Hospital in New York. So we're going to take a look at this subject from both sides. Joe, why are painkillers so dangerous and so deadly with so many different drugs out there? Why the painkillers?
Well, they're highly addictive for one. It doesn't take very much for people to build a physical dependence on them. The 90-day number that they're saying seems fairly arbitrary. You could become addicted to them much quicker than 90 days. I personally think that alcohol gets a free pass with this. I think if we're looking at the overdose problem and we're looking for the solution to it, if you view it as we're detectives and we know there are two murderers, why are we only looking at one?
So you're saying that the mixing of the drugs is something that the government maybe needs to look at or health officials need to look at rather than just restrict?
Right. From an anecdotal, and I don't have any statistical data.
But you work with people.
We do, and we see it every day, and most of the overdoses that we see happen when people are mixing alcohol with these medications. That doesn't mean these medications are safe on their own, and it doesn't mean you can't overdose with them on their own, but there is something that exacerbates the problem when people are drinking alcohol in addition to taking them.
Doc, what do you think about this? The LA Times had a report this weekend about this potential 90-day limit. So if you had surgery or you had some sort of pain, you get 90 days of a prescription for a painkiller, and that's it. Is that a good idea to consider?
Well, I'm very pleased that this issue is being raised. We prescribe 136 million prescriptions of hydrocodone compounds per year. That's 47 million patients who are getting these prescriptions. Yes, there are patients who need these prescriptions for legitimate medical need. After surgery, after wisdom teeth extraction, there are many patients with chronic pain. 100 million patients in the United States are taking these medications for chronic pain. So the problem here is not just prescribing these medications, but it's the length of the prescriptions, who's getting them, are they being prescribed appropriately, what's the time frame? You do not need 90 days prescription if you're having your wisdom teeth removed, so the length of the prescription is relevant. The problem with this issue is that we know that addiction is a huge problem, and the problem is getting worse. 15,000 deaths a year. But there are people who need these medications.
Well, and let me ask you a little bit about that, because it seems like these drugs are so dangerous. Are they so great that it's good to still have them on the market, or should there be maybe a consideration for even having these drugs legal and out there? I mean, are they so good for the people that need pain management?
Yes, they were originally developed for people with terminal cancers. So the issue was to keep them comfortable. We didn't really worry too much about them being addicted. There's a byproduct. So they do have a legitimate medical purpose. I think that the situation is that there's not enough controls put on it. I personally believe there should be an additional licensure for physicians to be able to prescribe it, where they would have to have some knowledge about addiction and what to look for and what to screen for.
What do you think about that, Doc? That's an interesting...
I totally agree with that, and I think also it's not just about the pill itself, it's about the education that goes with the pill. So we must be responsible doctors to prescribe, to remember to tell patients, do not take the pain medication if you do not require it. We should not be prescribing long courses. We should remember to tell patients about the risk of alcohol and other medications that may interfere. And we must also remember that when we're prescribing large doses of these medications, there's a huge number of these pills around in the home, and they need to be kept securely and safe away from people who may have access to these when they've not even been prescribed for them.
What about the access to alternative therapies? One patient advocacy group says they really disagree with this limitation because they're advocates for folks that do not have cancer but live with chronic pain, just as you were mentioning, doctor. But they were saying access to other therapies, whether it's physical therapy or anything else that will help a patient, is so challenging compared to actually getting a prescription that that's what we need to change in our approach to healthcare.
Pain management is something that's very much needed. I think that one of the things that we see that addicts do is they have chronic back pain that can't be identified. That's one of the things we hear all the time. It's this mysterious back pain that can't
Do you hear that too,
show
Doc?
up on an
I do,
MRI.
and unfortunately, many patients with chronic pain have not been formally assessed by a pain physician. There are doctors that specialise just in managing pain, but many patients have never had an appointment with those kind of doctors, and they've been on repeat prescriptions. And I do think there is a role for regular review of these patients to make sure that they are on the best regime, that we're looking at side effects, that we're reviewing these prescriptions.
Your final thoughts on that, Joe?
My final thoughts are that I think there's lots of ways to manage pain, for sure. I think that these are very dangerous medications. And you said that they kill more than heroin and cocaine combined. They also kill more than car accidents. So people have to keep that in mind, just the context of the scope of this problem and just how deadly it is.
Some great context for us today. Thank you both for coming in. We appreciate it very much, as always.
Thank you.
Thank you.
John?